Have you ever wondered what anti-aging tips actually work versus which are myths? Well, you're not alone if you have. My name is Dr. Jordan Carcaville, and I'm a Mohs surgeon and cosmetic dermatologist. By the end of this video, you'll be able to tell the skincare truths versus those hypes. Let's get into it. Myth number one, you don't need sunscreen if it's cloudy or you're indoors. This is a myth because UVA and UVB rays can penetrate clouds. So sometimes our worst sunburns can be on the cloudy days because we think we are safe, but really we need sunscreen and sun protection even on overcast days. Indoors, UVA can go through windows. So that also means in your car. So I see a lot of people with sun damage on the side of their face, and that can happen over years of chronic exposure on that one side, on that left driver's side, as we call it. So we do know that UVA is going through windows. So those are two myths. Sunscreen is still advisable on cloudy days or inside or in your car. Myth number two, expensive sunscreens work a lot better than affordable sunscreens. So this is a myth because what we are looking for as dermatologists is for patients to use what they feel good about using. And so it doesn't have to be expensive. It should be SPF 30 and above, broad spectrum coverage, UVA and UVB, and really most importantly, applying it evenly and frequently, typically every 90 minutes or more frequently if you're going swimming or sweating excessively. Sometimes there's commentary about skincare products being so much better if it's more expensive. I do have to say in certain skincare products, whether moisturizers, vitamin C's, or retinol, sometimes the higher quality, like maybe more expensive products are higher quality, especially with vitamin C, because it's hard to have shelf stabilization of an antioxidant for long periods of time. And some of the higher end products are just a little bit more stable, a little bit more elegant. But I will say my favorite moisturizer is very inexpensive and we don't have to spend a ton of money on some of the basics. So myth. Myth number three, you can erase wrinkles with topical creams alone. This is a good one because I will say that aging has many components and skincare can definitely help. And we can get a lot accomplished by using good sunscreens, by using retinols and retinoids, which do stimulate collagen, and using vitamin C's antioxidants to help fight free oxygen radicals. I will say anything absolute about skincare, getting you where you want to be is challenging. Skincare is about the slow process. It's going to be a small change that occurs over years and years. I think that combination therapy or approaches work the best for really removing or reducing wrinkles or optimizing your skin. And I think we need to look at the big picture and not rely on topicals alone because that's going to take a long time, if ever, to completely erase anything. Myth number four, drinking water alone can reduce wrinkles and hydrate your skin. I will say drinking fluid and water, hydration is very important for our whole bodies, and it does improve the skin. It helps hydrate the skin. It hydrates all of your cells. I think it's a pretty big statement to say that it's going to erase those wrinkles or make them disappear because it's not true. Sometimes when you do have more suppleness to the skin from hydration, the wrinkles can appear improved. But I think you're going to achieve that with good moisturizers, with lasers and such. Drinking water is always a good thing though. But water alone is not going to erase the wrinkles, sadly. Myth number five, Botox is meant for older people to treat only deep wrinkles. That's a myth. We use it in young people all the time, probably even more frequently in young people to help prevent wrinkles. So Botox and other neuromodulator brands, we employ them to help prevent our skin from contracting with the muscles. So when you stop that muscle contraction, you stop the formation of a wrinkle. So ideally, I like a neuromodulator to prevent the formation of wrinkles. Once a wrinkle has formed, we can use it to minimize the amount of movement, and those wrinkles can heal and reduce over time. But it's not only for older people, for sure. This is going to be for all ages. Again, I prefer over 20 but we can do it up through our 80s. I have several 80-year-old something patients who come in for it, and I'm probably 20 times more 20 somethings in the office for it. Skincare can be really overwhelming, especially with all the media and marketing outlets that we have nowadays. So I want to make sure that we can answer your questions and help you through some of these confusing commentary and buzz that you're hearing out there. If you found this video helpful and you would like to subscribe to our channel, join on. Otherwise, feel free to leave any comments below and come back and see us.